Okay, everyone, thank you so much for joining. Sorry for the late start. Good morning, good afternoon, good evening, everyone. We were just working through a few tech hiccups, so thanks for the extra few minutes. Unfortunately, we're not able to enable our Spanish-English interpretation today, so apologies to anyone who has joined us hoping to hear the Spanish interpretation. We will have materials available after in Spanish for you to hear from our speakers, but we do apologize for that. We're also just waiting for one more of our speakers. So I'm going to get us started, but we hope that she'll be able to join us soon. So my name is Julia Fan, and I serve as the Knowledge and Program Manager here at WomenStrong International. WomenStrong International finds, funds, and helps strengthen urban women-led organizations eager to learn and share what works and what doesn't in their areas of focus through their participation in a learning lab. Our learning lab covers 4 areas: girls' education and empowerment, women's health, violence against women and girls, and we'll soon be launching a lab group focused on women's economic security and opportunity. So we're excited to welcome you here today to this webinar entitled Community-Based Approaches to Addressing Violence Against Women at a Time of Heightened Risk. We hope you'll walk away from this conversation today with 4 key takeaways. First, from our esteemed panelists, you'll hear concrete examples of the creative ways in which feminist organizations have adapted and demonstrated resilience during the pandemic. Second, our conversation today will highlight why feminist organizations are well positioned to carry out violence against women prevention work during COVID-19, given their embeddedness in their communities, their in-depth understanding of women's needs, and their agility in pivoting and adapting without large bureaucratic structures. Third, panelists will share about how their organizations have continued to do this work despite huge obstacles, including a chronic lack of recognition and resources. Lastly, we'll identify specific priority actions that you, as members of the international development field, can take to better support the work of feminist organizations at this critical time. Now, a few housekeeping items for our webinar today. Again, we appreciate your patience as we have dealt with some tech challenges, and if we continue to deal with any of those, we do appreciate your patience. We are in webinar mode today, which means we can't see those of you who've joined us, but we do want your participation and interaction. We welcome your comments and questions in English or in Spanish, if you're still participating in Spanish, in the chat. And you can also join our conversation via social media. We'll share the hashtags for the event as well as our social media handles in the chat shortly. Now, while I introduce our panelists, please do use the chat box in the Zoom feature or on Facebook Live to introduce yourselves. You can write your first name, your organization, and your country so we know who's joined us. Today, we'll hear from leaders of 4 feminist organizations. Tina Musuya, Executive Director at the Center for Domestic Violence Prevention in Uganda. Teresa Shields, Co-Director at Centro Mujeres in Western Mexico. Sopheap, Executive Director at Gender and Development for Cambodia. And our moderator will be Laurie Michaud, Co-Director of Raising Voices. So let me introduce you to each of them and their organizations. Tina Musuya is the Executive Director of the Center for Domestic Violence Prevention. The Center for Domestic Violence Prevention is a Ugandan local civil society organization that works with communities, institutions, civil society, and the government to promote the rights of women and girls to create safer, healthier, and happier relationships, homes, and communities. Their work aims to create changes in the attitudes, behaviors, norms, and practices that perpetuate violence against women and girls and HIV in Uganda. The Center for Domestic Violence Prevention collaborates closely with Raising Voices on its violence prevention programming. Tina has 16 years of experience of working with communities, police, civil society, local government, and policymakers to prevent violence against women. She's also led the implementation of the successful pilot of the SASA program in Kampala, a groundbreaking initiative that reduced physical intimate partner violence by 52%. She coordinated the development of the Uganda Police Force Domestic Violence Handbook and the Police GBV Training Manual. As a member of the Uganda Reform Task Force, she helped draft and successfully campaigned for the passage of the Domestic Violence Act and continues to guide on its implementation. Teresa Shields is the co-founder and co-director of Centro Mujeres in La Paz, Baja California Sur, Mexico. Centro Mujeres empowers women, youth, and migrant communities to advocate for their human rights, including reproductive rights. Their advocacy, awareness raising, and community engagement efforts promote positive social change and improve the quality of life for people living in vulnerable communities. Centro Mujeres is a partner in WomenStrong's Learning Lab in the Violence Against Women and Girls area. Teresa brings to her work at Centro Mujeres a rich history of leadership roles in other NGOs with focused work on the rights of women and youth. She has served on the consultative boards of the State and County Institutes for Women in Baja California Sur, and as a citizen representative for women and migrants on the State Consulting Board for Sustainable Development in Baja California Sur. Sopheap is the founder and executive director of Gender and Development for Cambodia, a gender-specialized non-governmental organization in Cambodia. Gender and Development for Cambodia addresses gender-based violence by promoting mutual respect between men and women, enabling policymakers and institutions to address gender inequality, and strengthening support for gender equality at the national and local level. Gender and Development for Cambodia is a partner in WomenStrong's Learning Lab. Sopheap has previously held positions in government ministry and both international and national development agencies and programs in Cambodia. Under her direction, Gender and Development for Cambodia has become Cambodia's leader in capacity building and advocating for organizations, including government departments on gender mainstreaming, into policies, plans, and programs, and engaging men and boys to end violence and discrimination against women. She has brought the issues faced by Cambodian women to the attention of the international community and has spoken on women's rights issues in regional and international forums. And to moderate our discussion today is Laurie Michaud, the co-founder and co-director of Raising Voices, a feminist nonprofit organization based in Kampala, Uganda, working to prevent violence against women and children. Their work strives to influence the power dynamics shaping relationships between women and men and girls and boys by catalyzing social change in communities, rigorously studying and learning from the work they do, and sharing their experiences to shape the field. In addition to leading Raising Voices, Laurie has also spearheaded the creation of the GBV Prevention Network, coordinated by Raising Voices with over 1,200 members across the Horn, East, and Southern Africa. So again, welcome to everyone who's joining us. And Laurie, I hand it over to you.
Thanks so much, Julia. And thanks, very, very warm welcome to everybody who's joined us today. We're so happy to have this space together and this time together to really talk about what it has meant for women during this time of heightened risk during COVID. So we really, really welcome everyone and do encourage you to introduce yourselves so we can kind of have a bit of a small community right here together today in this 2-hour session that we'll do together. So as you all know, and as you probably all experienced, this year has challenged all of us in ways that we never ever could have imagined. And this was really particularly true for women and for feminist organizations. As a community and as a world, we've known lots of times of crisis, of course, from war and conflict in various places around the world to public health outbreaks such as Ebola in West Africa, Zika in South America, and of course, natural disasters across Asia, the Americas, Africa, and elsewhere. But the COVID-19 pandemic affected us all collectively and profoundly in a way that has probably not happened before in our lifetime. Through this year, we've all to different degrees really had to hold uncertainty. We've had to hold grief and loneliness and loss and anxiety. We've also, I think, and I've really seen and witnessed this year in unbelievable ways, how we've really deepened our empathy, our resilience, our adaptation, and our solidarity together. It's been like the bright spot, I think, for me, and I imagine for many of you as well. But it's also made us remember and reminded that now more than ever during times of crisis, that women bear the brunt of these consequences. We've seen an increase in gender inequality, an increase of burden on women, an increase of violence against women. And all of those come with dire social, economic, and health consequences for women and their families and communities. But even amidst such uncertain times, who stepped up? Feminist organizations, community organizations. They have been the ones who've really stepped up during this time. They're really the unsung heroes that we all have. They're rooted in communities, trusted, closest to the women and communities who rely on them. Having long-standing relationships, they are who people turn to during this time. And during the pandemic, even though those feminist organizations were in kind of crisis mode themselves, they stepped up and really responded with creativity and courage and commitment. They gave life-saving information. They were busy advocating to policymakers, providing emotional support and extensive practical assistance, like safe rides during lockdowns, to services for sexual assault. They were running hotlines, opening shelters, expanding shelters, doing outreach, providing emergency financial and food assistance and PPE, and so much more. So the conversation today is really an opportunity to learn from 3 rock star organizations who really stood up and stepped up during this time, and really stood with the communities during this crisis. We're going to hear from Tina in Uganda, from Teresa in Mexico, and from Sopheap in Cambodia. And during this discussion, we're really going to sink into some of the challenges they faced, and then how they solved problems, sometimes successfully, sometimes like with a lot of struggle and retries, but really how their communities really benefited because they were there and they were able to support during this time and continue to support during this time. So the insights are critical because often feminist organizations don't have the visibility that they really deserve. And during this time, especially when others were dealing with all sorts of other things, feminist and activist organizations really reached out to the community. So collectively, if we understand the experience of organizations more, then together we can collectively advocate and encourage and support their vital work in preventing and responding to violence. So with that, we're going to kind of do a bit of a discussion, but first we're going to ask each panelist to sort of set the context. You may be familiar with Mexico, but not so much Cambodia. You might be, so we really want to ground the discussion in the realities of the different contexts that they're in. So we're going to start, and I'll start with you, Tina, if that's okay. But just as a kind of start for our conversation, can you just talk a little bit about in Uganda, what was the COVID experience on the ground and in the policy response in Uganda? Over to you, Tina.
Thank you, Laurie, and hi, everyone. In Uganda, Uganda is based here in East Africa, and we were among the lucky countries where COVID was not so hard, but immediately the COVID situation became really bad. Our government took very quick action that was quite strict. We had an instant lockdown. They imposed a lockdown, and that meant that they closed all other services. And what was prioritized as emergency were only healthcare services. Everything else was not considered an emergency. And that meant that public transport system was closed down. Issues to do with access to maternity care was also not considered emergency services. Shelters for abused women were equally closed. And they were strict. They enforced this in a very strict way because there were soldiers with guns and roadblocks along the streets. And they would beat up women. So in our country, many women are involved in the informal sector. They are the ones who are market vendors selling food. So these women were advised to stay, as you can see in that picture, to live in those markets 24 hours without any gender sensitive kind of support for these women. That's how they were living in the markets. Their children and everyone else. In brief, I would say that our government's response was not, it was gender blind because the women were not really involved in forming this policy and the responses. Over to you, Laurie.
Thanks so much, Tina. Yeah, we all, as a fellow organization in Uganda, we watched especially the market women vendors with such worry and concern. But so many women were in such dire situations. And we look forward to hearing how Sopheap really stepped up during that time. So thanks, Tina, for setting that context for Uganda. I'll move over to Teresa, who can also share a little bit about what it was like in Mexico, how COVID-19 impacted women and what the situation was like in Mexico. Teresa?
Thanks, Laurie. In Mexico, the measures were kind of similar to what Tina described. The president's general response to the pandemic was focused directly on issues related to health and mitigating COVID-19. There was a shelter-in-place order designating COVID hospitals, but it was a very compartmentalized vision of confronting the pandemic and didn't take into account the rights or needs of women. In the case of Mexico, despite all the evidence from 911 calls, et cetera, of an 80% increase in gender-based violence during the initial months of the pandemic, the president of Mexico insisted on denying the existence of violence against women and increased during the contingent. He denied that violence had increased during the contingency and denied the existence of violence against women at all. In fact, the president went so far as to say that 90% of domestic violence related 911 calls were false, a claim he was unable to substantiate. And he was really setting the tone for the whole country. In response to these declarations from the president, the feminist women's movement really openly protested and demanded the president retract and recognize that violence against women is a horrible and cruel reality in Mexico. So the government, in an effort to kind of backpedal the president's declarations, created a campaign, Count to 10. And this was his way of addressing the issue of violence against women. It was a nationwide campaign. And if you aren't familiar with Count to 10, the idea of this anger management technique is that if you feel angry, you slowly count to 10 before you act, and that will give yourself time to calm down. And while that may be an effective technique for dealing with your children or a coworker, it's a completely erroneous concept for resolving violence against women. So that was met with more protest and more pressure from the feminist women's movement. And the National Human Rights Commission finally intervened and formally scolded the president, at which point the campaign was stopped and was replaced with one that was slightly more appropriate. The issue of violence against women and its increase during the pandemic were non-issues for the president. And the reality is that many of the preventive and reactive policies introduced to tackle gender-based violence over the years were subject to cuts in spending as a result of the pandemic. At the state level in Baja California Sur, where Centro Mujeres is located, the government's statewide response was to ensure that during the shelter-in-place order, everyone had food. It was kind of a one-size-fits-all approach that did not take into account the impact of the pandemic and how it had not fallen equally. And it didn't take into account the unfair burden that had been placed on women as they took on roles of caregivers, teachers, etc. Nor did the response address the dramatic surge of domestic violence due to the shelter-in-place order. The state and county institutes for women readily admitted that they didn't know how to respond or reach the most marginalized women in our state. The COVID-19 pandemic really exposed and aggravated gender equalities in Mexico. Thank you, Laurie.
Thanks so much, Teresa. The basic tenet, right, of believing women at such a high level was not even possible for the president, and amazing how the feminist organizations rallied around that. We will unpack that a little bit more as we move forward in the discussion, but thanks so much for setting that context, Teresa. We'll move to Sopheap, but I also just want to correct myself. I said 2 hours, don't panic. You didn't misschedule your morning or afternoon or evening. We'll stop. It's a 90-minute session, so I'm sorry. I was just feeling hopeful that we could stay on and chat longer, but we will stop after 90 minutes, so don't worry about that. And Sopheap, I'm going to hand over to you to help us understand a little bit about what was going on in Cambodia and what the context was in your country. Over to you, Sopheap. And I'm not sure if you can turn your video on or if it might be, oh, you did, great. Good to see you. Most welcome, over to you.
Hello, everyone. Thank you very much for the opportunity. And I listened to Tina and Teresa. We are similar in the situation of COVID-19 in terms of a policy, because recently the government of Cambodia had just adopted one law on preventive on against the COVID spread, the spreading of COVID. And this law have about like only 6 chapters, and chapter 3 is more on like have 10 articles on penalty. So for us, we don't have objection with these ideas, but we are concerning about if the law consider on penalty, and we concern that how can we apply, because most of the Cambodian people are poor and under poverty line, quite a number. So this is really concern, and the law had been adopted in the policymaker without consult with the voice of women, and especially the women's organization. And I just would like to add a bit about the real situation that generally women everywhere in the world consider and pay more time in the family work, in the household work. During the pandemic, women had a burden of double their time for the family, because you can imagine about when the migrant workers and everyone return back to home, and the burden of women is working to support or to cook, to the house chore is really an issue for women. So when the family members work separately, they have meals at workplace. And when they go back home, that all of them come and they request food from women. At the time that the income is very like lower or even none. So how can women find this afford for the family? And family member asking food from a mother. And daughters support mother, help the housework. And at the time, the men also return back from the migrant worker from the other country, also from the city. And then when they go home, they don't consider about housework, but they consider about their friend and drink and go out to drink. And women really concerned that this is following the restriction of the government, Ministry of Health, that stay distancing. And men do not listen. This is frustrating, starting in the family, and violence happen. This is men also frustrated because they have no job. They used to go out and they do something, and if they don't have something to do, they feel really frustrated. And the new study of the Liga-Do had found that more rape happened during the pandemic as well. This is really the concern that I really, our work with women, we discuss with each other about this issue. How can we deal with this, and how can we support? We also try to look at the policy, and the policy is really do not involve the voice of women. And on the other hand, that more than that make us feel a little bit like really scared is the Prime Minister announced that they reserved 10 hectares of land to burn the body of COVID victims. We know that it is really a good strategy to prepare, but considering about involving and looking at the direct need of the people is really also really important. And the goods and food increase, the price also really consider as well. So this is what I would like to share with you today. And also one more thing about the quarantine. Everything talking about quarantine and quarantine. In Cambodia, our country is still not have enough facility for that. So some of the a hotel had occupied and to prepare for quarantine, and some place like a school, primary school or secondary school prepare for the quarantine. And the quarantine had put like 6 to 8 people, and the toilet use and all of these things is really concerned. And also when the quarantine, where is the law address about how to ensure that women and girls are safe from that quarantine? Because when quarantine, of course, restrict that we could not visit them and they stay distant. And the people who are in the same room, they are talking, they stay together, close to each other, and do not restrict with the policy that announced by the government. This is really a kind of, you see this is kind of a little bit like contradict between the policy and the practice. So how can Cambodian, as a small country like that, with a lot of people that are living in the poverty, could adapt with the policy of the government? I don't mean that I reject with the policy of the government, but would like to see the consideration of the policy maker to look at what is the real urgent need to address right now in terms of vulnerable group, the girls, the women, the disabilities, and the people who are at risk. Thank you.
Thank you, Sophie, so much. There was so much in there to unpack, from challenging government and non-responsive government response to the extra burden of poverty, to the burden of care, there is a lot in that, Sophie. Thank you so much for sharing that. It's really important to remember how so many of these issues are interconnected, and they affect women in so many ways. So after setting the context, let's move on to how did your organization really think about adapting and responding to sustain the work that you were doing on violence prevention, violence against women prevention in particular during this time. There were lots of new kind of emergencies and challenges and increased risks for women in a harder environment to actually work within. But then how did your organization, if you can share a little bit about how you responded and adapted to that? And Tina, I'll start with you again.
So in our case, because we were cognizant of all these challenges of gender blind response by government, we had to do what we women's rights organizations are always good at, feminist organizations. We communicated with each other and checked in with each other to see what was it that we could do very quickly, because we knew our women and girls are not safe in any way. So as usual, we started to mobilize even when we were working from home. We took quick measures to make sure that our staff stay working. They were working from home, and we made sure that they were connected through internet, and we networked with other women's rights organizations. Then, of course, the next thing was like how our community mobilizing work for preventing violence against women. How can we make sure that it's sustained? And because we have activists who are rooted within those communities, we had to do the quick thing, call them on phone because they are not connected on internet like us here. And we checked in with them to see how they were doing and started to guide them because they were feeling abandoned. Everyone was confused with, mean-looking soldiers and policemen who were beating everyone who was walking by. So we started to organize, and we took advantage of, in some of our communities, the lockdown couldn't happen because they live in close proximity. They're like little houses with very many people sitting by their verandas, working from their homes. We were like, we are activists. We can still, we infused COVID prevention messages into the violence prevention messages and encourage them to talk with their family members, their neighbors, to continue violence prevention. And because they were already known in those communities. So now our task was to give them the content that was befitting the situations that they were in. Now, because they could not hold these bigger events, they focused more on supporting men and women to address the relationship kind of stresses at the household level. And then secondly, we have what we call Ubuntu. In Uganda, it's like the collectiveness, solidarity, whereby now our activists, because of this feminist kind of programming, people have feelings for each other, they care for each other. So our activists, men and women, were reaching out to their neighbors to really see how they were doing. And because they were already resource people, they were at the forefront of distributing the emergency, the relief food that government was giving. So as they were distributing the food, they were infusing in violence prevention ideas in that and encouraging men and women to seek for their support when need be. Then again, we focused on supporting the men and women to have better relationship skills about negotiations, listening to each other, and together they were able to address whatever challenges that they had in the house. If they had little resources, they collectively made decisions about what to spend the money on. So in us as a communities, there was like the violence levels did not really go high as in other places. Then they also focused on other stressors of how could they parent their children. You know, they were locked up with their children who were not going to school. Now that came in very quickly. Again, we're like, okay, who is working on children's issues? Again, we checked in with Raising Voices Good Schools program. We're like, okay, how do we support our activists with parenting issues so that they are not totally stressed out? And again, we realized that there were many survivors who needed, if you were to pay for transport, you had to get permission from the residence district commissioner. And that meant that that transport would cost a short journey of, let's say, 2 kilometers. You had to pay close to $50. Now, we also continue to run the emergency fund and increase the amounts so that some of the women who needed urgent support to run to a safe place were able to give that money. And again, we had the referral cards that, because we are known, we work with the police, the government, and everyone else. When women had their referral cards with our logos on, and they showed up the roadblocks, they were quickly supported to go to access services. So for us, this was that the solidarity, the support for each other really worked very well for us as feminist organizations. And then the communities also focused on holding perpetrators accountable, since the justice system was all closed and there wasn't any other way in which they could stop this violence. And then we repackaged a lot of our work into the electronic version, and we ran radio programs. We had the mobile speaker phones that our activists were, taking out and airing out all these aspirational messages around violence prevention. That's how we quickly adopted. And I'll hand back over to you, Laurie.
Thank you so much, Tina. I think it just so beautifully illustrates so many things, but one, having fertile ground, like having activists, like the importance of like ongoing community organizing and community mobilization, so that there's people in communities that already are there and have been doing this work and are trusted by others. And I think your example of the referral cards is like particularly interesting, because an organization might it takes an organization who's really deeply connected to the context and what's happening to know that like just a simple card with a logo could get a woman safely through a checkpoint, right? And so I think just like that really lived experience and really being connected and hearing and listening to women and the challenges that were on board, and having enough sort of clarity within institutions and what's happening within institutions. I mean, it's just like such a beautiful example of how both of those sort of, come together to really support women during this time. Thanks so much, Tina, and for the creativity and resourcefulness of Sopheap during this time. Teresa, I'll move to you, and maybe you can talk a little bit about how your organization really adapted and responded during this time to all these new challenges that you also faced.
Sure. Centro Mujeres has been working with and for women and adolescents for 26 years. So we're well known throughout the state for our community work. And we also have been engaging in local, state, national, international advocacy as part of the feminist women's movement. This really uniquely positioned our organization to respond to the pandemic. We were informed by women in our community about their lived experience. And at the same time, we were connected with feminist networks in Mexico and Latin America. And these perspectives really supported our organization to develop a well thought out, gendered response to the pandemic. One of the first things that we did, Centro Mujeres sits on the advisory boards for the state and county institutes for women. So one of our things that we wanted to do was make sure that they were responding to the pandemic. So we worked with them to communicate and to develop a strategy to disseminate information about prevention of violence and how to access services during the confinement. Initially, their ideas were to socialize information using infographics on social media to reach women and girls throughout the state. We had to kind of steer them so that they could really develop messaging and dissemination efforts that took into account the disparities of women in our state. So we really worked with their messaging and their dissemination. As an institution, we adapted our programs. Some of our programs went online. Some of them became hybrid, but we really took a stand and decided to focus attention on migrant women and youth. Migrant women in our state come to work in the fields in agriculture, and they come from some of the poor states in the south. They come from Veracruz, they come from Oaxaca, and they're bussed in and they're taken to these ranches where they live and where they work. So during the pandemic, what happened were that these women were basically locked onto these ranches. So if you can picture, Baja is almost an island. It's a peninsula with water on each side. And from the tip at the end of the peninsula to the end of our state, it takes about 12 hours to drive it. There's one road that goes north and south. And on each side of that road is pure desert until you get to water. So these women come and they're in these ranches. So if you're going north and south and you take a west or an east on a small dirt road and you travel for miles and miles and miles, in the middle of the back and beyond, in the middle of nowhere, is a ranch. And it could be a ranch that has 10 workers. It could be a large agricultural enterprise with 2,000 workers. But these workers are bussed in, and they're in these areas that are completely isolated from population centers. So during the pandemic, the gates were closed. There were guards at the gate, and no one went in and no one went out. So women were really just basically trapped on their ranches without the ability to help. And most of them aren't from the state. They don't know where they're at. They don't know where the population centers are. They were just really in a situation of extreme vulnerability due to their isolation, their social exclusion, and their poverty. So we had to really work. We had to think about how we could reach these women. We came up with a lot of ideas, but basically it's very difficult to gain access into a ranch. So based on our experience, we knew that if we could reach women, that they would reach out. So to impact the situation, we made personal hygiene kits that we distributed to migrant women throughout the state. We made about 6,000 kits, and the kits included violence prevention information, as well as health protection items and hygiene resources. The flyer included multiple ways to communicate with local authorities and to communicate with Centro Mujeres. We activated our 1-800 number to be used as an emergency line, and we got some mobile phones, so we were able to activate WhatsApp so that women could message for help. and they did. So it was a very effective strategy. We received lots of phone calls on the 1-800 line, on our regular line, and we received a lot of messages through WhatsApp. As I said earlier, we also focused on youth, and Centro Mujeres youth program, they took a look at their own audience and they decided to launch a video campaign on social media. So the videos were written and produced by young leaders in the program. And they had one that was aimed at young women that provided them with resources for help. And there was another that was aimed at young men with prevention information on how they could prevent global gender-based violence with their partners and within their communities. And the videos were had a really great reception. So those were our two, in addition to our regular work, those were two very specific, focus on specific population interventions that we did. Thanks, Laurie.
Thank you so much, Teresa. It's so interesting how you're like, part of it, you didn't want to go online because you knew you wouldn't like be reaching women who, you know, really needed the information and services. And then in other ways you went online on WhatsApp and others to reach other women when you couldn't get within the ranches and private property. So really adaptive ideas, Teresa. Thank you so much for that. Sopheap, I'm going to move over to you. If you can share a little bit about your organization's response and adaptation.
Thank you, Laurie. Our nature of work is we work directly with people, and we have numbers of activities that gathering people up to 50, 100. We do the campaign and forum, etc. The COVID exists sudden, then this is really stop the activities that we could not organize as what we planned. So our staff start to discuss internally and try to find a way how we can do. And technology is also quite new for us, but of course there are some areas that we can improve and we can work, and we also have some other staff who are quite good in that. So we teach each others, and then we open the discussion about how we can review our activities. So the activity were divided into small group and also into online workshop and meeting discussing. And the most important also, we keep collaboration with local authority, because local authority is the part of accountable to cooperate with us in terms of ending violence against women and women areas. So to do that is helping us to learn another step, another skill, that means that nothing can stop us, nothing can stop our activities, nothing can stop our sharing. So this is really helpful for us as well, that we can teach our network and also our beneficiary group who are, it doesn't matter you stay where you are in the community, you are in the remote area where you can access to the internet, we can share the concern issue and information. So we use that one campaign we call Dare to Speak is the most campaign that we create to ensure that sharing and speak out is important for us, because the message share with each others, because you know Cambodian is a culture of silence. We learn that silence could not be solved the problem. So when we speak, when we share, this is the issues that we can adapt with democracy and the right to speak. So women had learned from time to time from each other, from one to another, that if we don't speak, who will speak for us? If we don't raise the voice, who will raise for us? If we don't exercise our rights, when we can use our rights. So this is really all the message that we bring together, and this message had been done before, and then we continue to use through online and through phone call, and we keep communicate with each other so that we can support each other on time. We keep this, the beneficiary group also feel warm, because when the country had restricted not too crowded, we stay in place. So some community had have a house far from each other, which is really easy for in accident. So when visiting the household is really important for us, that keeping sharing with each other, warming each other. Sometimes we share about the issue of domestic violence, or the issue, the new issue, new message from the world, and the message from the policy maker and to the community people, and bring the issue from the community people to us. Sometimes it's not just about our message from our strategy, but just keeping us to have the communicate with each other is just really helping us to release our stress. And also we working for the message about working with the, you can imagine about the LGBT, the society, our society is still very deep patriarchal and discrimination. So the LGBT, they have been discriminated, their family violent to them. When they return back, it is the community, and they have to challenge with the family with violence against them, and also the community that discriminate to them. So this message, we continue to work with parents, we work with community to stop discrimination, and we work closely with the community, local authority as well, to ensure that local authority is accountable to their role related to stop discrimination and violence against women. We have a commune, women and men's core group that work in the community, that they are living in the community for 24 hours. So they know about the issue, they know the area where is the vulnerable group, and also they learn about, they visit and they bring this issue to the local authority. And this, if there is something happen, then they cooperate with local authority and work with the police that they can support on time. On the other hand, we still have keep communicate and keep working and sharing with the women's network at all levels. And we also not only have at the national level, but we have the network and international support each other that give us very support, and we don't feel isolated, even we stay in house or distant, but we still keep inform each other about our activity, and you are not alone. So this is can support each others. Yeah.
Thank you so much, Sopheap. It's, yeah, the importance of networks and having them already exist, right? Like you didn't have to start from scratch at the beginning of the pandemic, similar to what Teresa was saying. And also Tina was saying that because they've been doing this work for so many years, they had such extensive networks at the community level, within institutions, within civil society and other feminist organizations and women's movements, that it was like just ready to pick up. So it's just such an important example. Thank you so much. We're really excited to see some questions in the chat. We're going to go to one more question, and then we will start picking those up. And I'm going to ask the panelists to be a little bit brief in this question, because so we have a little bit of time to get to questions. But we really wanted to hear from you. You know, it's been such a crazy time. It's been such a time of transition and change and learning. What rises to the surface when you think about, okay, if I really reflect on the last year, these are my, you know, 1 or 2 learnings, takeaways, that like, this is what I really feel like profoundly, you know, I really learned, I changed in this way over this year. And Tina, I'll start with you, because that's just where I'm starting these days.
So in our context, there are things that are big takeaways. one of them was the backlash against gender equality work in Uganda. We saw again a lot of prominence in pushback. Like, for example, all the response when cases of violence were quite rampant, the women were being blamed for the violence repeatedly and saying that they are stressing men who have lost their jobs, and that's the reason as to why violence is happening. And many girls were sexually abused. So again, they were blaming religious leaders, government groups, and everyone else was blaming the girls for throwing themselves at the men. And again, they were warning women to be submissive and kinder to men if they were to avoid the violence. And even the other response mechanisms that they brought along. For example, they opened a toll-free line that was mainly the police. So these toll-free lines, when survivors would call in, they would mediate cases and tell them to just be patient and behave well and not to disturb men. So the whole principle of do no harm was not observed at all in a lot of these responses. So in my case, I'm like, when emergency hits, how are we observing the principle of do no harm? If, for example, they were enforcing the restrictions and forgetting that women had to access maternity care, had to access psychosocial support, had to access HIV treatment, but all that was disregarded. So the principle of do no harm, how do we observe it during emergencies? And then just as Laurie was saying, our work that is grounded in the community with solid networks is quite innovative because you work together to come up with context-specific solutions to the emergency that has come. Take, for instance, our community activists who are rooted in those communities and the opinion leaders and the ones who are in response institutions took it upon themselves because they feel the pain. They know the need for safety. They made it, they were compelled to take this work forward while they were observing the COVID prevention measures. They went ahead to even support each other about how can we even eat because people were not going to work, they would make like a shared meal within their own neighborhood to ensure that they are sharing the small resources that they have, simply because they feel connected with each other and they want good for the other. Then lastly, they use every opportunity to promote violence prevention. When they were distributing the food relief, when they were at the water sources, encouraging people to wash their hands and distributing the masks that we gave them, they would infuse violence prevention message and remind everyone to be non-violent. Over to you, Laurie.
Thanks, Tina, so much. I like the idea of just sprinkling it into everyday life, not having like one big thing, but it's like part and parcel of everyday life. Thank you so much for that. I'll hand over to Teresa. A couple things that you really felt like were your big learnings or takeaways.
Centro Mujeres really kind of hit the ground running. We closed our doors shortly before the official shelter-in-place order was given. And that gave us time to ensure that all of our staff and their families were taken care of and that everybody was able to work from home. We wanted to make sure that everybody had connectivity, that everybody had a device, and that everybody had masks and other personal protection and hygiene supplies that they needed to stay safe. As an organization, we became very flexible, and we worked to care for our staff and their families. We had to respond to the unfair burden of care that was placed on women, and the people in our organization are women. So we had to incorporate that in our response. We wanted to be congruent as a feminist organization. So we really placed a lot of effort on the pandemic, during the pandemic, to keep our staff in the center, as well as our community work. We just, everything wasn't normal, and we had to take into account the needs of our staff. So we really relied on their creativity, our experience, and we really went back to basics in order to care for our staff and so that we could move our community projects forward. We also relied really heavily on our sister organizations, nationally and internationally, that shared our feminist values to support us in calibrating our response and obtaining a realistic read of what was happening to women as a result of the pandemic, and to gauge what interventions were working in the areas of the countries that were ahead of us in the development of the pandemic. And this gave us models and methodologies that we could adapt to our work, and provided information that helped us inform our strategies. So this was really critical during the initial and mid-pandemic. When we talk about the first year and we look back, there are so many takeaways related to the prevention and attention of gender-based violence and how it impacted women. But I've focused on two that are kind of indirect, but for us just as critical. The importance of networking among women that act based on the principles of Cairo and Beijing, and the importance of taking care of our staff. These two actions were really key for our organization to be able to guarantee a sustained commitment during the pandemic to generate creative solutions and to maintain the momentum so that we could positively impact gender justice and the health and safety of women in our community. Thank you, Laurie.
Thanks so much, Teresa. I think that we haven't really discussed yet the importance of starting with ourselves. We can't kind of do all this work to support women in communities unless we're actually starting with the women right inside our own offices that we work with and ourselves every day. So I think that that's such an important point that you brought across, Teresa. Thank you for raising that. Sopheap, I'm going to go over to you, and if you can share one or two lessons that you all learned throughout this year.
We have few lessons learned, and one is I would like to share about the billboard. We built the billboard and we put in the community, and that billboard had designed by the community people, and also where they want to put that the people can access. And this billboard is to work with men, that if men frustrate or get angry, please find the men's group in the community to discuss and release the anger. With that, don't just go direct to violence. This is really effective in the community, and local authority also collaborate with this message. And this is really a strong message in the community, where the community people feel that this is their own message and their own activities, and they take in account to implement. And working with men is really part of helping to reduce the violence, and also to support the women's leadership. And also, we still working on the collaboration with the local authority to ensure that the group of women that bring the issue to discuss with local authority, because we create the safe space for local authority and the community people to speak, especially young women, that they usually they had restrict not to speak with the local authority. And you know that in Cambodia, local authority are really a kind of conservative people, because they are living in the age of this position for long times. So we don't target them to be gender sensitive at any stage, but if how much they can understand, how much they can change is that. But our target is to open the space and with us, and then the space in the community to bring with the young people that who are the agent of change, to bring together and discuss with each other. This is really very effective in our activities that we work. And we still use as Dare to Speak is very effective, and from one to another share with each other the meaning of this and caring with each other, and then they work with peer-to-peer education. This is really important as well. And we bring this to the parents about the parents' role is not tell children what to do, but to support children to make the decision. This is, we like break the culture, we break the big barriers of culture of silent.
Thank you so much, Sophie. Yeah, the connections between people during this time, especially youth, who are being much more creative sometimes than many of us, of how to connect to each other during this time sounds like it's been really critical for you. Thank you all so much. And I really want to welcome all the folks on Facebook Live. Some people joined that way rather than on the CSW platform, so you're all really welcome. We do have a few questions that I'm going to ask panelists right now before we go on to the last part. One of the questions is around how to work. You know, I think many of you were talking about what does it mean to do to work with folks who are gender blind, who don't recognize the gender dimensions of COVID-19 and how this is affecting women. And maybe one of you could just share a little bit about how, you know, you feel like it's important and effective to work with folks who really, you know, might be starting from quite a different place than you are. Would anyone like to comment on that?
Well, I can speak to that. I think that our organization has been working for many years, and we try to approach the issue of sensitizing gender blind officials, whether it be in government, in a school, in the health department, in the justice department, through a lot of different means. We have campaigns, we hold roundtable discussions, we do workshops. But I guess my point is that it really is a kind of a slow process. It's not something that happens all at once. We make sure that all of our work has gender perspective in the spaces where the spaces that we have that are in mechanisms that are part of the government. We make sure that they're having gender perspective in their work, but at the same time, we're trying to sensitize others through a lot of different means, because it really is a process, and it takes time.
Thanks so much, Teresa. Yeah, absolutely. That, you know, it's a really long engagement and long process. And that's why you kind of can't pop up at the beginning of a crisis and sort of think, okay, like, you know, this is how we can engage folks. It really has to be relationships over time. That is what we found also to be most effective. Tina, I saw you had taken off your mic when Teresa started to speak as well. Do you want to talk on that at all?
Yes, I think Teresa highlighted most of the issues. I just want to add a little bit that for us who have been working in this area, know that all sectors have a goal on gender equality, but we are cognizant that they are still having issues around capacity, and they do all these things from a good point of view, but now it's our role for us to support them to see that there are certain gaps, as Teresa was saying, and these gaps, if they are not filled, of course, the intentions of what they are doing, they will not achieve the goals. So we support them to see the consequences of being gender blind and the benefits of being more gender sensitive. And then we guide them along the way. And that's why it's important as feminist organizations to work across the social spectrum so that we have trusted allies across the board who, if we give feedback, they take it in good faith and they see the value that we are bringing, and we are stuck in there. So that's how the only bit that I wanted to add on what Teresa said.
Thanks so much, Tina. Absolutely. All right. Another quick question is, are there materials for engaging men around prevention during this time? And I know Sophie popped in some of the Raising Voices materials into the chat, and she can feed those over to the Facebook Live. But does anyone want to say anything else about that? If you come up with anything, panelists, you can stick it in the chat for everybody. I know that Tina's been using some of the SASA materials as well. And then we have one final question is, many people are asking, so how can I get involved? What can I do? And I think we're gonna hold that question. So panelists, have that in your mind, but hold that question for a minute, because we're gonna go a little bit to round 4 to really talk about, you know, what are the urgent issues, and what do you feel like are the priorities for you during this time and collectively, not just in your own country, but for women more broadly during this time. And I think we'll put up a slide around this, but Sopheap, I'll start with you this time, just so I just mix it up a little for Tina.
Hello, thank you. I would like to share with you a bit about at GETSI, we have the Cambodian Men's Network, and the target of Cambodian Men's Network, we want to work with men who are violent. But we could not select all of men who are violent. We work with the men who are willingness to stop violence, men who are who feel bad when hearing men commit violence. So when we work with them, and then they will talk with men, because men bring the issue of men themselves, and they open the space to discuss together. It seems that they listen to each other, and they are in the same issue. So they open the space, and they don't feel interrupt, or they don't feel like somebody listen to them, that they don't feel comfortable. So we just open the space for them to discuss. When they discuss, they found that the relationship of women, the relationship with their family members, with their wives, is really a part of issue that they need to discuss, especially with their intimate partners and or wife. Because when we discuss about relationship, in our culture, we have women code of conduct. Women have to stay quiet. If the husband or partners feel angry, you have to stay quiet. But at the meantime, our country right now is we adopted the domestic violence law in 2005. This law had stated that we have to report. So the culture of practice and the law, the current law, is really contradict. And then at the time we advocate and we raise awareness about raise your voice and report if there is violence. So this helping the people to start to learn, to know about the law, the policy, and start talking with the local authority, with the police, and also talking with men themselves about violence. And there are some issues and cases. If we compare from 20 years ago or 15 years ago, Cambodian feel like domestic violence or discrimination is just okay. But right now, people start to raise about this issue. So it means that our so to aware about the rights of women, that violence against women is not allowed. So this kind of thing that helping men to be more careful, and also women raise the voice, and police also start to act, and the local authority also start. Even though we know that there are still a lot of stereotype, but in practice is compared to 20 years ago is in the way on the awareness. Yeah.
Thank you so much, Sopheap. Thanks so much for that contribution. Tina and Teresa, maybe you can share a little bit about some of the asks for policymakers and donors. One of the comments in the chat were these for everybody or one particular country? And one of the things that we've been doing during the preparation for this and over the year, working in our different networks and organizations, is really recognizing that there are some very key asks that we have for policymakers, for governments, for funders, and for each other. And so these are really that could be applied in any context and certainly apply globally. So you can pick and choose what feels the best for your community and your country, but knowing that these key asks that we're going to share just now really are very widely applicable, and many feminist organizations, in addition to us, all of us on the panel today are asking for these things. So I'm just going to ask panelists to speak very, very briefly on your key asks. Teresa?
I think I have two, and I'll be very brief. The first one is we have to recognize that NGOs are first responders, and during a global crisis, local advocacy takes on a lot more importance, and it's key for the implementation of strategies with impact. Local feminist organizations know their community, they know what it needs, and they're the best ones to advocate on its behalf. But in order to act, NGOs have to have flexible funding to be able to respond quickly and to respond to a rapidly changing context. In our case, we had two feminist funders that really, at the onset of the pandemic, said, "Don't worry, I know it's a project grant. You know, the money's flexible. Do what you need to do to take care of your people and your community." And that really enabled us to move quickly. So flexible funding is key. The other thing I would say is that no matter what the crisis is, environmental, biological, war, local and state governments need to include and they need to listen to local feminist NGOs. They need to be involved, NGOs need to be involved in the planning and in the decision-making for a crisis to make sure that the government's response plans have gender perspective and that they're socially inclusive. Thank you, Laurie.
So important, Teresa. Thank you so much. And I'm just going to hop right over to Tina.
Building on what Teresa said, I think, and also we are calling to everyone out there to increase investments in mental health and self and collective care for staff of the NGOs and for the entire violence prevention programming, because as you can see, this is heavy. People need to be well. You cannot give what you don't have. So that's extremely critical. And my final ask is we need to embed feminist principles in crisis response to avoid all those challenges that we're talking about by ensuring that we are addressing gender inequality, promoting inclusivity, so everyone shouldn't be left behind, and strengthening accountability at all levels. Over to you, Laurie.
Thank you so much. And Sopheap, would you like to share about the practical measures would you like to share on that last bullet?
The most important right now that we need to be flexible is look at the family who are really could not get the income and no food. Because right now in Cambodia, really addressing this issue is needed. We, the Gender Cafe women, when we have difficulty to find a job, they don't have more job and we could not meet, and then they request that maybe can support them. So we really thanks to our donor that we flexible to support this. This is really important. And also we need to also, I want to add the look at, we have a policy, but we want the policy to be enforced as well. And we need to, the policy to be respond to gender perspective, not the policy blind, because as we discussed from the beginning, policy blind is not give women with benefit from the policy, and if the policy is not used, we benefit kind of leadership that we're looking for. So that's just what I want to share.
Thank you so much, Sopheap. Exactly. I think so many of those very practical things that we can do and we can encourage governments to do, not lofty statements mostly, but really practical, simple things that they can do to really, really impact women's lives during this time. Thank you all so much for that. It's really helpful. We do have a poll going on. If you go back to the NGO CSW site where you signed in, there's like, you can see it says chat, poll, files, and people. Anyone can take the poll. You're all most welcome. Thank you for many of you who have been doing so already. It looks like several of you have answered the poll. We're going to give you a minute or two to do that. And also want to open up, of course, to anything else that you'd like to share. One of the questions that emerged was, how can we get involved? How can I get involved as somebody who's listening to this panel? And I think, you know, I'll hand it over to panelists if you would like to say something. I'll just say very briefly, I think, you know, get local right now is where it's all at. It's really, really where it's all happening. So, you know, get in touch with feminist organizations near you, join networks of feminist organizations, do your own activism, speak to your own neighbors, ask women that you know, are you okay? Do you need help? What can we do for you? And so really trying to just small and big ways to really reach out to those around you, both on a personal level and also on an organizational level. These amazing organizations around the world, including the panelists here, are really stepping up at this moment to support women. And so make those connections, reach out. And panelists, is there other things that you would like to say about how folks can get involved right now, using your platforms, using social media? Any quick thoughts?
I think, Laurie, you summarized everything. I would like to encourage the participants to just keep following the conversations and chip in on top of all the issues that Laurie raised.
Thanks so much, Tina. Great. Well, it looks like from the poll, there's like, it's neck and neck. we all want many things. So right now, it's really neck and neck, that women's rights organizations really need to be consulted, involved, and listened to, that we really desperately need to allocate flexible funding for women's rights organizations, that we need to embed feminist principles and crisis response. Those are all getting the exact same amount. And then the investments in mental health and self and collective care has also been really, really critical. And, you know, all of those together will really lessen the direct burden on the pandemic for women and girls. Great. So I think I'll just briefly wrap up. Panelists, if you have any burning last things, put them in the chat, please. But I just want to really give like very deep gratitude for contributions of Tina, Teresa, and Sopheap. Their feminist organizations are doing so much incredible work in their communities and also at the national level and also globally. So we really deeply appreciate your intense efforts during this time, despite it all. Hearing from all of you and your realities, the struggles, and how you've been able to overcome it and really make the pivots is really inspiring and motivating. And we thank you so much. You know, when there's so many large organizations who during this time have really struggled to be agile, to overcome bureaucracy, and to be trusted in communities, feminist organizations were there and are still there during this crisis. And we really need to register this moment because feminist organizations are critical. Local response is critical, and we are best placed to do that. We can really listen to women. We can believe women ourselves and encourage and really pressure, as we heard from Mexico, our leaders to do the same. We can pour our energies into large and small efforts efforts. Small efforts really matter that promote and protect women's rights and health and well-being. I think, as you heard from the panelists, as feminist organizations, we can rally around key asks that will really benefit us all to ensure that women are at the table, every table, when talking about women's experiences and priorities, and using an intersectional lens. So not just assuming that every woman is going to experience this the same, but thinking about women at the market, thinking about migrant women, thinking about young people, thinking about everybody, how their own identities and diversities are really impacting how they experience this pandemic. For those of you who might be in INGOs or UN agencies, hear the experiences, recognize and respond by really treating feminist and activist organizations as partners. We're not implementers. We are partners and we are leaders in our own communities. You can support these efforts to respond and engage, help us and respond and engage the communities where we have deep, deep relationships. For governments and funders, you can make violence against women's services essential. You can prioritize women in policy directives and resource allocations. And for funders, you can provide that flexible funding where we can be iterative and organic and really respond to issues that emerge as they emerge in our communities. There's so many ways. Get creative, think, talk with each other, talk with other feminist organizations, and really figure out how we can really support women and feminist organizations during this time. I want to thank everybody before I hand over to Julia for joining the discussion today. We know that the CSW alone has so many things that are just, it's very hard to pick and choose, not to mention we're all sort of Zoom exhausted. So amazing appreciation to all of you who were able to join today. We would really love to connect with you. Thank you for everyone who contributed to the chat and who are also direct messaging on the side. We really appreciate that. Please reach out to WomenStrong and Raising Voices, reach out to any of the panelists. We will be writing a blog together, and we would love to incorporate other examples and ideas from all of your work as well to really highlight and elevate the voices of women and the experiences of feminist organizations. And of course, to just all stay connected. So thank you all so much for joining during this time, and all gratitude to the panelists as well, and everyone at WomenStrong who's been really holding this piece, especially all the tech and all the organizing us all. So thank you all so much. And I'll hand back over to you, Julia.
Thank you so much, Laurie. Thank you so much, Teresa, Tina, Sopheap, for all of the inspiring examples and the work that you've all been doing over the past year and will continue to do, and well before COVID as well. Thank you to everyone who joined. As Laurie said, many ways to get involved and stay connected with all of us. Please do reach out. We'd love to hear from you. And that's it. Enjoy the rest of your CSW, and thank you so much.